Today, it's Sunny and Cher, except it's just Sunny. Yeah, his name's Sunny. Hi guys, so here I am today with Sunny, who is a 24-year-old gentleman, and he has not had anything done before, right?
Yeah.
Okay, first time for everything. I'm going to pop your cherry. So tell me, what areas is it that you're thinking you want to treat?
So basically, I feel like most of my face is pretty flat.
The entire thing, just a face transplant, okay?
Like really round, so there's not much definition in like my jaw and my chin. I think my cheeks are pretty flat too.
Okay, yeah, so like the whole thing.
Yeah.
Okay. Let's get the iPad and we can have a look at that together.
Sure.
So I know you've seen some of the videos before, and one of your friends has been in before as well, Fran. So what I was kind of thinking was it would be quite nice to crisp up the jawline, as you say. And also, for me, one of the things that I notice is the position of the brow, with the tail of the brow being pretty low in comparison with the head of the eyebrow. Sometimes that can make the face have this like kind of sad look. Now, it's not too bad when you're young, but as you get older, it just gets worse and worse. So I think if we just pop a bit of filler underneath the eyebrow itself, we can kind of raise up the corner of the eyebrow a little bit. I'm never going to get it like all the way up here, but I can definitely improve how it is now, I think, and give you just like a bit of a stronger look there.
Less of a sad face.
Yeah, exactly. Less sad. And then definitely doing a wee bit of cheek augmentation there would be good, I think. And also, I know you guys at home, if you've been watching the videos for a while, you'll know about the different ratios that we use on the face, and how on a man, when we measure the distance in between the eyes, we use the phi of that distance to determine how wide the chin should be, for example. So on you can definitely take a little bit more width there, I think. I think the length isn't too bad, but the width we could definitely improve on. And also I'm just seeing a bit of this as well, right there. So maybe we could even pop something here underneath the eye, help with that kind of slightly tired look. I'm just going to grab the image of you smiling just to see how that compares. So interestingly, when smiling, there's almost this sort of area here on both sides, you know, where it kind of bunches up there a little bit. I think if we just pop a little bit of filler behind that, we could probably blend that in, so it's not as clear to see. But I want to see the side view, because I think that's where most of the action's going to be. This section here on yourself is a little bit stepped back in comparison with the chin, which on a guy is great. But it does sometimes lead to this sort of angle, you know, where it's almost like quite flat in the front part of the face. So if we pop a little bit of filler here, it will also help that nose to mouth line that's just starting to make its appearance at the tender age of 24. So I do think pop a little bit here as well.
Sure.
And I also noticed that when you're smiling as well, you do show your lower teeth quite a bit. That is something that might be modulated slightly, so reduced slightly when we put some filler down here. So you often find that the lower lip is actually pushed up slightly, and it just basically gives you a more youthful appearance if you do that. So I think you're kind of what I would just call like classic enhancement. You know, all those areas are areas that a lot of people would like to have done or look good when they're done. So nothing special about you, I'm afraid, in that way. So in terms of the treatment, is there anything that you're thinking, oh my gosh, I'm a little bit worried about that? Or what do you think people are going to say?
I'm not really that bothered about what people are going to say.
Excellent. Good.
I don't really care, because I know that I'm going to look good.
Glad to hear it. Excellent.
But I'm not that worried about pain.
No?
No.
You're
I think
fine.
the only thing that scared me is when you said about blindness, but I've already watched the video. In-depth video about blindness. I'm not scared anymore.
It's good to do your research about these things. Yeah, very good. So sounds like you're pretty confident with everything that we're about to do.
Yeah.
Is that because you've seen your friend as well?
Yeah, I
through
think
the
so.
experience.
Yeah.
Yeah. Totally. Okay, well, let's go and do it. So let's have a look at exactly what we did. So we're starting off first with some Radiesse and using that with a cannula at the angle of the jaw. And here we're doing 1.5 mils per side because Radiesse comes in 1.5 mil syringes. Then I'm going to split another 1.5 mils between both sides. So right now we've used 4.5 mils. I'm switching now to Juvederm Ultra 4 and we're doing the chin. We're trying to widen the chin here and we're doing 0.5 mil on each side. Going now to use Radiesse again and we're crisping up the jawline just underneath the jawline here using a cannula. This is 0.75 mils per side. Ultra 4 again now in the temple using 0.5 mil per side. Temples are super important because they affect the brow position and also the eye position laterally. So if you have got too much hollowing here, it can make the eye look quite sad. Juvederm Voluma using a cannula. I'm injecting 1 mil per side to each eyebrow. Now we've used a total of 9 mils. Now we're using Radiesse again and a cannula. We're going to put 0.75 mils per side of the cheek. Now switching over to Juvederm Voluma, we're going to be doing 0.5 mils per side just at the base of the nose. Now that's actually quite a lot to use in this area, and the reason is he's extremely flat here. We've used a total now of 12.5 mils. Going back to Juvederm Voluma now, we're going to be doing the front part of the cheek and he's got 0.3 mils each side and again just the lateral part of the cheek 0.2 mils each side. This is to really make the front part of the face a bit rounder. For the upper eyelid, I'm using TSL Redensity 2, which is specifically designed actually for the under eye area, but I also use it in the A-frame as well. I'm using the same insertion point as I use for the eyebrow treatment, which, you know, I do try and minimize the number of times that I have to inject my patients. We're also going to do underneath the eye with Redensity 2 as well and with a cannula. So up until this point, we've used 14.5 mils. Going back now to Juvederm Voluma in the nasolabial area, I'm using a cannula to take it right the way from the end of the nasolabial fold right up to the base of the nose. And for this, we're using 1 mil per side. And that takes us to a total of 16.5 mils. Okay guys, so here we are back 6 weeks after Sunny's treatment. How did it go?
It went really well.
Yeah?
Yeah.
How was it in the immediate aftermath? You have a lot of bruising, swelling?
It was swollen
Yeah.
for a bit. I looked a bit like Action Man. But bruising, I honestly had like the slightest bruise, I think here.
Yeah.
But honestly, nothing else apart from that.
Lovely.
Yeah.
So, had any nice comments? Anybody said anything?
Yeah. I've had compliments from a few people that already knew I was having it done. But to be honest, a lot of people haven't noticed, which I'm kind of glad about.
Yes.
Because it obviously looks natural.
Yes. I guess it's kind of that double-edged thing. Do you actually want people to say, wow, what have you done?
Yeah.
Or just say, oh, you've been away or something like that.
I think it helped. So I went on holiday straight after, like 2 days after. So I think people were confused about the tan and just...
Yeah. You obviously just well rested from the holiday. So which area do you think was the biggest success for you?
I think mainly my chin and jaw is the part that I like the most. Because it was so round before and now it's cut and straight.
Gillette style. So is there anything that you would do again?
Yeah, I feel like I'd probably do it all again. It didn't hurt.
That's very good.
It was great.
2 thumbs up there from Sunny. I personally particularly like, for me, the brow area.
Yeah.
And I think maybe we could do something more here at some point in the future.
Yeah, the under eye.
Yeah, I think so. Because although you generally look a lot fresher, for me that would probably be the next step along. But looking good in general, I think. Yeah. very pleased.
Thank you.
Okay guys, so that's it for this week. I hope you enjoyed the video. Thanks for coming back, Sunny. Maybe we'll have you back at some point in the future. Who knows? Who's to say? Join us again in another couple of weeks where we will be seeing another patient. If you have any comments or just anything you'd like to say, just leave it in the down section below and I will try and get back to you. Please don't forget to like, comment and subscribe to the channel, and I'll see you later.